Hi, this is Sakina Alston, Dominica Rocho, Serena Gurphy, and Viola Pierce, and we are MSN students at ECPI University, and we are in the leadership track. Today we're going to present a case study and answer a few questions for a continuous quality improvement implementation study. Next slide. In this particular case study, it's a financial analysis and quality management in Patriot County, Ohio. So the director of Patriot County, Ohio Health Department received a financial analysis from his fiscal officer. The fiscal officer relayed current information explaining that after the terrorist acts of 9/11, funding for the local and public health departments had been funneled towards surveillance and preparedness efforts and redirected away from overall LPHDs. LPHDs must compete with other agencies for state and federal funding. LPHDs must prove effective and efficient use of public resources. Next slide. The fiscal officer recently learned of the trend of use of financial ratios for quality improvement in public health departments. It is noted that there's a lack of transparency and accountability in how public health revenues are spent. LPHDs had not yet made it standard practice to utilize standard financial ratios to report the state of the organization's finances. Financial ratios analysis is a common language for reporting an organization's financial state. Next slide. LPHDs have cut services due to poor financial management. The finance official recommends use of financial ratios to assess and report LPHD's capacity to provide services. Next slide.
Okay, thank you, Sakina. I'm going to now go into the next couple of questions that were related to the case study. So for question 1, it says, what do you think of Thad Bruschi's analysis, as well as did we identify all the key issues of financial concern for the agency? When going on financial analysis, the costs and inefficiencies to help increase capacity and allow for a greater focus on population-centered service. Fiscal officer Thaddeus Bruschi, who has an MBA, sought to do just that when he gave his financial analysis to Dr. Robert Chernow, who has a PhD. And he's also the director of Patriot County Health Department in Ohio. Next slide. When trying to answer those questions, you want to look at some of the pros and the cons listed in the case study. Initially, the analysis seems to be a bit long and can be overwhelming trying to interpret all of the findings. Financial analysis should include an executive summary that is concise and directly states its major points. This is to allow for a thorough overview for the reader. Otherwise, the actual breakdown of the financial analysis was very helpful and comprehensive. The language and flow of the report was fluid and easy to comprehend. Thad's analysis kept the focus on funding specific services and programs rather than the infrastructure itself. In regard to the revenue, the analysis specifically spoke about how the major source of income from the county is down by 2.5%. This is in contrast to the noted increase of expenses. In the case study, it speaks about holding local health departments accountable for the revenue spending. Next slide. Next, we're going to discuss some key issues of financial concern. It seems that Patriot County is spending more than they have coming in, which is a sure way of landing the institution into irreversible debt and possible closure of the facility. Not only does Thad give a finite number of how much the hospital is in over budget, he provides an in-depth review of the specific areas where funds were going directly to and offsetting the expenses in a negative manner without actually putting money back into the hospital. Especially important was the highlight of borrowing revenues from one program to cover another program, but when ultimately the funds just weren't there. Patriot's total margin is a negative 3.9%. While I'm not 100% familiar with financial lingo, this was clear to understand that the financial negative ratio is clear to be going in the wrong direction. This is a prime example of overextending funds. One of the most critical areas of financial management is the analysis and control of those funds and costs. Next slide. The next question concerns Dr. Chanel, and he mentioned three possibilities. A, transmitting the material to the Quality Improvement Committee. B, keeping it under his head and mixing it with other information he had as the agency's head. And C, just some other response. So we presented to the group, and the question was, what would we recommend that he do with this information? Next slide. The common consensus was to form a quality improvement committee, and that's because CQI serves several purposes relevant and has improvements that can help this facility. Ultimately, the purpose of CQI is to help assist public health organizations achieve the quality aim of population-centeredness. It can also be used to navigate through financial challenges by reducing overall costs by increasing quality and capacity, as well as allow for a greater focus on population-centered services. The first step is to making systematic improvements as to how things are handled financially. From the report, it would seem that Dr. Chanel would want to go with one option to form a quality committee. A quality committee will enhance the efforts to build the organizational capacity to continuously improve public health. When looking at the negative total margin indicator, one learns that the facility is operating in a surplus and that needs to be monitored more closely to figure out necessities. Depleting funds such as the general fund balance for other expenditures can put the facility in a deeper hole if not assessed. The committee will also have to serve to acknowledge which programs and processes have actually been working for the facility. By eliminating additional expenditures that are not profitable, it gives the facility more opportunities to create new ventures that will generate good revenue and a diversification of that revenue. Next slide.
Thank you, Dominique. Question 3. Would you consider this approach to be primarily a quality improvement tool or something else? So the tools that were used in this case study was, the first one was a financial ratio of the Patriot County Health Department. This ratio uses financial indicators to assess fiscal and operational activities. Financial ratio analysis also allows organizations to make projections about their operations, providing valuable insight into the future, and the value of the financial ratio relies on the accuracy and the validity of the data that is used. The other ratio that was used in the case study was Tad Grabowski's ratio and trend analysis of the Public Health Department. This analysis, which is broken down into categories and findings, I think can be used for quality improvement projects because they have a list of all the weaknesses that needed to be addressed. Next slide.
Thank you, Sakina. So what do you think of the fact that Thad's findings seem to be new to Dr. Chernow? So the current situation is that they basically had a lack of transparency concerning their spending. There was no accountability. There was lack of standard financial ratios, and there was a lack of analytical tools in order to be able to the spending was. So public health departments are typically an arm of the local government. Therefore, they lead in the organization. The lead in the organization typically doesn't delve into the financial functions as they do in a freestanding organization, healthcare organization. The revenues, they decreased by 2%, which is just a small margin, or you would think will be a small margin in the fiscal year 2008. So, but that small margin created a deficit of about $247,849. Medicare reimbursement only increased by 0.6%, and that only gave them back about $8,000. They had their services decreased by 7.1%, so they weren't doing as much, delivering as much care as they normally would. And then the county revenue decreased by, again, a small margin, you would think, 2.5%, but that is $13,015. And then the whole home health program revenue decreased by 24.4%, which was $128,000 and $790. And so that would, that's a lot of money to have as a deficit for them. Now, to go on to their expenditures, they increased in their expenditures by 1%, which was $129,349. And then their total expenditures was higher than the total revenue at $472,305. So, and then 50% of the accounts receivable were written off as uncollectible. And so they didn't have a really good way of collecting the accounts receivable. And then they had also a growth in their unsupported programs from 11 programs to about 18 programs. And so they needed a way in order to be able to go back in and collect the uncollectibles. They needed maybe an outside agency to help them with that, and also to understand why they're having these deficits and to have a better control over the spending.
Okay, so question 5 is what do you think of the concept of financial management quality? Next slide. Okay, right here. So financial management is necessary to sustain any organization's operations. As we saw in the previous slides, they'll go into financial deficit and won't be able to function. The healthcare crisis that we're currently in does not allow for mismanagement of finances. We're already in debt. The consumers and the organizations are. Finance management ensures funds are available for current needs and trends. It helps eliminate disparities, and it helps us to allocate funds appropriately and address leading health indicators. Just a little bit more detail. So quality, we're talking about financial ratios as a quality method. So quality means getting the right care to the right person at the right time. And money management allows for that. So can you slide down a little bit on the notes so I can see it? Okay, financial management quality is important and relevant to sustaining an organization's operations. So when funding, ensuring that government funding is appropriately and effectively utilized to purchase and provide population-specific services is essential to population health and eliminating healthcare disparities in specific areas. For example, if an area has proportionately high HIV rates, the money should be allocated to HIV prevention and so on. Next slide. So the class exercise asked if we should, it said what kind of financial tools should we use to address the situation in this case study. And so revenues, liabilities, and assets must be reviewed and reported in order to address this situation. A zero-based budget should be applied to help the LPHD prove efficacy and necessity of programs and services. In this case, demographics of the population coupled with a zero-based budget analysis might provide insight into how funds should be reallocated away from housing permits and redirected towards newly uninsured persons. That was information from the financial report, gives us that information. And there was also a decrease in revenue but an increase in full-time employees. This should also be reviewed, because if they're providing if they're getting less revenue, maybe they're providing less services, but then they shouldn't be hiring more people, so that doesn't match. So when you do a zero-based budget, the organization is forced to scrutinize services and processes to prove the necessity and efficiency of those processes. And this type of budgeting ensures appropriate use of funding and ensures that funds are allocated in the most efficient and useful manner, so that organizations do not continue to have expenditures on services that are not current or applicable to the current consumer. It also makes it so that funds are made available to provide services for current needs and trends, like I explained above with the people who are newly uninsured and they don't have houses. They don't need money for housing permits. They need money for because they don't have insurance. And next slide. This is just our reference slide. We're just, that's the conclusion of our PowerPoint and the answers to our questions to this case study.
Thank you.